Hey everyone, welcome back. Today, we're going to talk about a medication that nurses often encounter when caring for patients with urinary issues, Darifenacin Hydrobromide. It might sound like a mouthful, but by the end of this lesson, you'll understand exactly what it is, how it works, what to watch for, and how to educate your patients about it. But before we begin, check out our extensive nurse test bank to help you pass nursing school and the NCLEX. The link is in the description below. So let's begin by thinking about this scenario. Imagine you're caring for a patient who says, "I can't stop running to the bathroom. Sometimes I don't even make it there in time." That kind of problem is more common than you might think. It's often due to overactive bladder, a condition that causes sudden urges to urinate, frequent trips to the bathroom, and even urinary incontinence. And that's exactly where darifenacin comes in. Darifenacin Hydrobromide, known by the brand name NCLEX, is a medication that helps manage symptoms of overactive bladder. Its main therapeutic use is to reduce urinary urgency, frequency, and episodes of urge incontinence, which means helping patients regain control and confidence in their daily lives. Now, let's talk about how it works in the body. To keep it simple, our bladder is controlled by the nervous system, specifically by a neurotransmitter called acetylcholine. Acetylcholine binds to muscarinic receptors in the bladder's smooth muscle, telling it to contract and release urine. In an overactive bladder, those receptors are a bit too excitable. They send frequent "go pee now" signals, even when the bladder isn't full. Darifenacin is classified as an anti-muscarinic or anticholinergic medication. That means it blocks the muscarinic M3 receptors in the bladder wall. By blocking those receptors, darifenacin prevents the involuntary contractions that cause the bladder to squeeze when it shouldn't. The result is fewer bathroom trips, longer time between voids, and fewer accidents. Patients who take darifenacin often notice improvements after about 2 weeks, but full benefits might take up to 8 weeks. The drug is typically taken once daily, usually in an extended-release tablet form that can be swallowed whole, not crushed, chewed, or split, because that would interfere with the controlled release of the medication. Now, like any drug, darifenacin doesn't just act on the bladder. Because it blocks muscarinic receptors in other parts of the body too, it can produce some familiar anticholinergic effects. Let's go through those in a friendly, memorable way. The most common side effect is dry mouth. And trust me, patients will notice it. It happens because darifenacin reduces saliva production. Encourage your patients to sip water frequently, chew sugar-free gum, or suck on sugar-free candy to relieve that dryness. Another frequent effect is constipation, since the medication slows down the movement of the intestines. Patients should increase fiber intake, drink plenty of fluids, and stay physically active if possible. Sometimes a stool softener may be needed. Other side effects include blurred vision, dry eyes, and headache. Some people may feel drowsy or dizzy, especially at the start of treatment. Because of that, it's wise to remind patients not to drive or operate heavy machinery until they know how the medication affects them. Less common but more serious adverse reactions can include urinary retention, meaning the bladder holds too much urine because it's too relaxed, and confusion, especially in older adults. Since darifenacin affects the nervous system, elderly patients are particularly vulnerable to confusion, agitation, or memory changes, so close monitoring is important. Now let's step into your nursing role for a moment. Imagine you're preparing to administer this drug. What should you do? First, review the patient's history. You'll want to check for urinary retention, gastric retention, narrow-angle glaucoma, or severe liver disease. These are contraindications. Patients with these conditions shouldn't take darifenacin because the drug could worsen them. Next, monitor urinary output patterns, before and during therapy. You want to know if the drug is helping the patient void less frequently, but still adequately. Keep track of any signs that the patient is unable to empty their bladder fully, like distension or discomfort. Also, assess bowel patterns, because constipation can sneak up on patients. Encourage regular elimination routines, and if needed, report severe constipation to the provider. Keep an eye on vital signs and watch for dizziness or lightheadedness. Because darifenacin can cause blurred vision and drowsiness, safety precautions are key. Make sure patients rise slowly from sitting or lying positions to prevent falls. Now let's focus on patient teaching, one of the most important parts of nursing care. When you're explaining darifenacin to your patient, make sure they understand why they're taking it. Many people feel embarrassed about bladder problems, so this is your opportunity to provide reassurance and education in a compassionate way. You might say something like, "This medication helps relax your bladder muscles, so you don't feel the urge to go as often." That simple explanation helps patients connect the purpose to their daily experience. Teach them that the medication should be taken once daily at the same time each day, and that it may take a few weeks to notice improvement. Consistency is key. Remind them not to crush or chew the tablets. They should also avoid alcohol while taking darifenacin, as it can worsen drowsiness. If they use other medications that have anticholinergic effects, like antihistamines or some antidepressants, those can increase side effects, so they should talk to their provider before combining them. Patients should drink enough fluids to stay hydrated, even though, they might be tempted to drink less to avoid urination. Dehydration can actually make constipation and dry mouth worse. Also, since dry mouth increases the risk for dental issues, it's important to suggest regular dental checkups and good oral hygiene. If constipation becomes uncomfortable, they can increase fiber and fluids or use a gentle stool softener under guidance. You can remind them, if you ever notice you're having trouble urinating, or if you develop confusion or severe dizziness, contact your provider right away. Those can be signs that the dose needs adjusting. In elderly patients, education is especially important because they may already be taking multiple medications. Encourage them or their caregivers to keep a medication list and review it regularly with their healthcare provider. Now, just a quick note about effectiveness. You'll know the drug is working when the patient reports fewer bathroom trips, less urgency, and, an improved quality of life. It's always rewarding when a patient says, "I can finally sleep through the night without waking up to run to the bathroom." Before we wrap up, let's do a quick review to test your understanding with 10 true or false questions. Ready? Here we go. Darifenacin Hydrobromide is primarily used to treat constipation. Gap 5 seconds. Answer: false. It's used to treat overactive bladder symptoms like urinary urgency and frequency. Darifenacin works by blocking muscarinic M3 receptors in the bladder. Let's think about that for a moment. Answer: true. That's its main mechanism of action. Patients should be advised to crush or chew extended-release tablets for faster absorption. Does that sound right to you? Answer: false. Tablets must be swallowed whole to maintain proper release. Dry mouth and constipation are common side effects of darifenacin. Let's pause and consider that. Answer: true. They're the most frequent anticholinergic effects. Blurred vision and drowsiness may occur, so patients should be careful when driving. The answer is true. Caution with activities requiring alertness is essential. It's safe to give darifenacin to patients with urinary retention. The answer is false. Urinary retention is a contraindication because the drug can worsen it. Darifenacin can cause confusion in elderly patients, so they should be monitored closely. The answer is true, especially in those with pre-existing cognitive impairment. Patients should limit fluids while taking darifenacin to prevent frequent urination. Okay, let's pause and think about that for a moment. The answer is false. Actually, they should maintain hydration to reduce side effects like dry mouth and constipation. Alcohol can increase drowsiness when taken with darifenacin. Let's take a second to consider this one. The answer is true. It can enhance central nervous system effects. Nurses should teach patients that improvement in bladder symptoms might take several weeks. Alright, let's give this a little thought. The answer is true. Patience and adherence are important for best results. And there you have it. Darifenacin Hydrobromide, an anti-muscarinic medication that helps calm an overactive bladder, giving patients back their sense of comfort and control. As a nurse, your role is not only to administer it safely, but also to educate, encourage, and monitor your patients closely for side effects. Remember, medications like this are more than just pills. They're tools that can dramatically improve someone's quality of life when used properly. So the next time you see Darifenacin on a medication list, you'll know exactly what to look for and how to guide your patient through it confidently. Thanks for tuning in and studying with me today. Keep reviewing, keep asking questions, and keep caring, because great nurses are lifelong learners with compassionate hearts.